dosha. It's people who are extremely well balanced. But when they get ill, it's very difficult. As a practitioner, as an Ayurvedic physician, let me tell you, it's very difficult to treat them because it takes a while to get them to understand their personality type and basically the type of lifestyle that is important for them. Now, another thing we need to know, there is nothing different about Ayurveda. In Greece and other Western, we have traditions, we have something called the four humors. You're probably familiar with sanguine personality, choleric personality. We even have it in our language in Russian. We have melancholy personality, and that all came out of Ayurveda. Anybody in college took Myers-Briggs test, the personality test? You know, extrovert, introvert, all of this. This is also based on Ayurveda because it all came from Carl Jung. And he traveled to India quite a bit, and so he was able to translate that. Rebbe is a Vata Kapha, by the way. So, what do we need to know as far as lifestyle adjustments? Vata needs light exercise, yoga, dancing, walk by the beach. Pitta can exercise quite a bit and feel very well as long as they're balanced. Kapha needs to move. It doesn't really matter what Kapha does, they just need to move. If you look at herbal medicinals in Ayurveda, and that's when it gets a little bit too complicated. Again, this is a 20-minute speech. I just want to introduce you to a few little concepts. There's herbal medicinals for Vata, Pitta, Kapha to pacify something and to bring it on. I will tell you a very real example. You know, this is difficult economic times, and a lot of people have lost their jobs and been downsized. And let's say 3 guys work in the same company. You have your pure Pitta, Vata, Kapha, you know, for the sake of a speech. Now, what happens if they are told one day that they will be laid off? Here's a typical response. The Kapha doesn't take it seriously, doesn't believe it. He's a very jovial guy. He's not particularly a hardest worker in the room, but everybody loves him. So he thinks it's not going to happen to him. So 3 months down the road, he gets downsized, he gets a pink slip, he gets very depressed, he starts eating too much, he starts eating too much sugar, he lays on the couch and his wife yells at him. Eventually he gets up and he tries to get a job. He gets a job that is not suited to his personality, he hurts his back, he goes on disability, and that's the end of his career. Now what happens to Pitta? The Pitta man is the real worker. He's the scrappy one. He's the one with the personality that is a pusher. He gets very angry at his boss. He quits right there. He says, nobody's going to lay me off. And within 2 weeks, he has another job. Not only he has another job, he probably gets a job with a competitor. Now, Vata person is not surprised at all. He's relieved because he has seen what is happening with the company and he's been preparing. He's been taking classes. He's been very anxious, he hasn't been sleeping, he's been worrying, so now he knows exactly what's going to happen. Most of the time he has something saved, and he even started his own business already. So here is a primary example how our personalities have to do with how we manage what happens to us, because as we all know, it's not what happens to us, it's how we manage it. Does that make sense? So another primary important thing that I want to know before I ask you, perhaps if you have any questions, then Rebbe has arrived, so I will cede the podium to him. What is really important is you understand that every person is individual. Ayurvedic medical system, in a way, is so much more advanced than the Western system because it's almost like they knew about DNA. And so everybody who comes through my door is being treated as an individual. Also, it depends on your age. Kapha is a young age. You know, when you're young, you have fevers, you tend to have lots of mucus, runny noses, and so on. Then we grow up and we have Pitta. We have hormones, we start having children if that we so choose, and then finally, Vata is the old age. We get wrinkles, we get dry skin, we become a little bit more fearful, and so on. So let's say that you are a person of a certain type of constitutional type, what we call dosha, and you happen to be in your older age. So when I work with somebody, I understand that what we need to do is we need to pacify what is in excess, and we need to balance things that need to be balanced. Does that make sense? Any questions? Because we're running out of time. This is a very short introduction because I can talk for 3 hours about it. Go on. So anyhow, what are the foods that we need to know about? Now, Pitta tends to like hot and spicy food. So when Pitta is stressed out, Pitta needs to calm down. It needs to watch alcohol. It needs to watch sugar. Now, Vata needs to eat more fat, more beneficial fats, more dairy, more fish, and so on. Kapha needs to slow down on sugar. The primary problem with the Kapha is sugar. So many people who get type 2 diabetes, we need to pacify Kapha and bring out a little bit more Vata. Now, fibromyalgia, anybody has heard about this new condition, chronic pain. Now, you would think that it has to do with Pitta because it has to do with muscle, but actually it has to do with Vata. Because doctors realized that people who suffer from fibromyalgia for many years don't sleep well, and they have central nervous system disorder. And as long as we make them sleep and calm them down, the nerves and the muscle calm down. So you can see how it can go from place to place to place to place. Recently, I had a very interesting hour-long radio appearance on a wonderful radio station called Menopause, Magnificent Menopause and Beyond. I know, fellows, it's a little boring, but just remember, women go through this premenopause, perimenopause, menopause, and postmenopause. So that's 30 years, pretty much. Might as well get used to it. Anyway, and if anybody wants to hear that thing, it's that show. It's on my website. I can tell you about this later. And I actually discuss different menopausal symptoms for different constitutions. Vata get anxiety, and they have osteopenia, osteoporosis. Kapha has terrible night sweats and weight gain. Pitta has high blood pressure, and they have hot flashes and so on. So you could see how we can take every condition and we can find out exactly how we can best use this system, holistic system, with an H, to better serve the public.
Where am I?
You are a Vata Pitta. You are very mentally agile. You are very young at heart and spirit. And you're still very interested in life. You are well proportioned. Probably when you were younger, you were a bit of a handful.
Younger? Almost laughing.
How about now?
Oh, I'm not saying anything.
That was just last week.
Okay. And so it's very good because you've kept your constitution, but also you learn how to manage your stress and manage other things. So it's excellent. Vata also lives a little bit longer than they think, because many times Vata also is very good for panic attacks. They get very worried, very scared. Sometimes they become very childlike and very clingy. Pittas are the most independent of all the groups, and they need to learn how to relax a little bit. Of course, when you have not a perfect type, it's much easier. It's much easier to have a combination type. One of the most difficult cases I've ever managed, it was a lady who was a Kapha Pitta, which is hot water. She had absolutely horrific menopausal symptoms. She was pretty much disabled. She could not work. She was diagnosed with hypertension, diabetes, fibromyalgia. The medications weren't working for her. She was very frustrated. So basically all I did is I calmed her down, and I explained to her that for her this is normal. And then we started treating her. And little bit by little bit, thank God, we're getting better.